Attendees are in listen-only mode.
Hi, good afternoon, everybody, and welcome to this webinar on behalf of the NHS Sustainability Day campaign. I'm glad you all could join us. Today is talking about our Sustainable Development Management plans and how they can be utilised within your NHS Trust. The key aim of the webinar really is to offer support and advice to those individuals who may be implementing an SDMP, who maybe have already done an SDMP, and who may be thinking of conducting one in the near future. An SDMP, a Sustainable Development Management Plan, was created by the Sustainable Development Unit a number of years ago as a policy document in order for trusts and organisations to use it as a strategy to implement some of their sustainable development initiatives. So I'm going to touch on that a little bit soon, a bit more about that, but I do want to introduce some of our speakers today. So we've got Claire Igo, who's Head of Environmental Sustainability at Central Manchester University Hospitals, Alexander Hammond, Sustainability Director at ETL, and Adam Newman, who's a Senior Sustainability Consultant at WRM. So today they are going to give us an overview of their experience implementing a Sustainable Development Plan, certainly from Claire's and Alexandra's perspective. Adam's also going to touch on that from some of the work they've done with Leeds Teaching, but also from how you can put together an SDMP and some of the tips to do that. The reason why we're doing this today mainly came on the back of a survey we conducted back in July. And that survey was aiming to look at the progress on sustainable development across the NHS to date. We had 46 NHS trusts complete that, which is quite high for some of our surveys, and it gives a probably around a 20 to 25% of the actual trusts who would host this SDMP as part of their contracts with the NHS. Within that, it was clear that there was some progress. Over 50% of people who completed the survey said that they were getting significant support from senior management. 2018, 70% said they were not. So there was an improvement. But the main thing that we found was that 33% of those who completed the survey, which would be around about 15 to around 15, 18 of the trust, said that they did not have an SDMP in place, and it's been estimated that 25% of NHS trusts in general don't have an SDMP at all. And the campaign at that point has geared up to call for SDMPs to be mandatory, and that is something we're working towards as a campaign. I've had discussions with the SDU and NHS England around this, and although SDMPs are part of the reporting and NHS contractual obligation, it is not a prerequisite to have one. Therefore, it's just a necessary, or it's the trusts are being told that it would be something that would be useful, but it's not mandatory. And we think that if we're going to meet some of the carbon emission targets and play a role in the climate change progress, certainly within the NHS, that an SDMP must form the backbone to this. Therefore, it's a very key document for everybody to have. I know there's organisations out there who've got them. And with that in mind, if you guys take a look at the handouts, which falls within your tab, to the right of you, you will notice that we have got 4 SDMP documents there that are available for you guys to share. They come in from Dorset, Derbyshire, 2 actually from Derbyshire, Word and a PDF, and then the final one is on behalf of NHS Improvement and the SDU, which was given to me by Fiona Daly, who heads up sustainable development across the states and facilities. So please feel free to take a look at them and share them. Today's recording will be provided on Tuesday to everybody and uploaded onto our website. So feel free to share it with colleagues and utilise it as best you can. This is all about sharing learning. But without any further ado, I'm going to introduce Claire, who will be our first speaker, followed by Alex, and then followed by Adam. So I hope you enjoy the webinar, and any questions, please feel free to add them to the bar, and I will take questions and put questions forward during the presentations, and I can also put some questions afterwards. So thank you very much.
Okay, thank you. Can I just check that you can see my screen? Okay, thank you. Claire Igo from Head of Environmental Sustainability at Manchester University Foundation Trust. Start by just giving some very brief organisational context.
Just to jump in there, have you got? Can we just see your PowerPoint? We're just seeing.
Oh, can you not see it? I have just shared my screen.
If you just go down to put it on your PowerPoint, we should be able to see.
Just go down to what? Sorry.
Your PowerPoint presentation and click that, because at the moment we're just seeing. So head down to PowerPoint at the bottom.
Sorry, I don't know where you mean, Scott.
All right, is that your?
Let me. Wait, just give me a second. I think it might be on the other screen. Just give me 1 second.
There you go. Yeah, we're just seeing the good.
Okay. Yeah.
Well, that's fantastic. Thank you. If you
okay. Right, we're on. Is that okay now?
That's brilliant.
Okay, sorry about that, everyone.
Cheers.
So just briefly in terms of organisational context, we're a really large NHS acute trust, and we've got a group chief executive, group board, and then we also have individual hospitals and hospital groups with their own chief executives. So the size and scale of the organisation brings huge challenges around reflecting that vast range of services that we provide, but also huge opportunities in terms of improving environmental performance. So we've got some hospitals in the group that are really proactive in the way that they address the environmental agenda, and others that are less established in this. We've also got the added complexities of PFI contracts in place at 2 of our hospitals, and we host 2 local care organisations, so we have community services to consider as well. So I'm pretty sure we've got all types of, well, many types of hospital services covered there. So we underwent an organisational merger in October 2017, and this brought with it the requirement for a new organisational strategy. One of the legacy organisations had an SDMP, and the other one had a carbon management plan. So we were in a good baseline in terms of where we started out. We started planning for a new sustainability strategy early in 2018, and then we started that process in May of 2018 once things had settled a little bit after the merger. The timing was really good because the new guidance that Scott referred to before from NHS England and Improvement was out, and the Sustainable Development Unit. We were one of the first trusts to be able to make use of this. So we were conscious of our organisation's ambition around this agenda, and we also wanted to properly address the anchor institution agenda. So when we also, I should have mentioned them really, we had a combined authority with a Greater Manchester mayor who had identified environment as one of his key priorities as well. So it was a good place to start. So before we got going on the process, we set out our aspirations. Wanted to make sure the strategy was sufficiently high level but also meaningful. We didn't want to be obviously looking at it every few months and thinking, oh, we need to update this, but also being conscious of focusing on the areas where we could make the most difference and set ambitious but achievable objectives. We were conscious that previous strategies had been more estates focused, and we wanted to look wider at all aspects of the sustainability agenda. It needed to reflect the needs of the whole of the organisation, and we were keen to make sure that we had a full range of stakeholders involved in that process so that they would feel that was co-created by them as well. And of course, we needed to make sure that we were focusing on the right areas for carbon reduction. We didn't want to use a consultancy to deliver this work on our behalf, but what we did do was we engaged a creative company that we'd previously worked with, and then they facilitated some of the workshops. We wanted those to be independent from being run by the sustainability team, and they also provided some creative design and editing support, as we didn't have the in-house capacity for that at the time. So that was the right approach for us to take, but I do understand it's different depending on the organisation that you work for. And so on this slide, I've shown the main stages of the process that we followed. And we delivered this process over about a 6-month period. So we started by looking at legacy plans, and both of those legacy plans and how we'd performed on those, what had worked and what hadn't. Then the next stage was doing a baseline assessment of current carbon footprint, bearing in mind this was quite soon after a large organisational merger, so maybe not as quite straightforward as it might be in other organisations. And then we looked at performance against the Sustainable Development Assessment tool. And at that point, we also took into account other organisational strategies that were relevant. Things like equality, diversity and inclusion, and nutrition and hydration, anything that really would have a sustainability element to it. We then convened some workshops. I think it was 3 or 4 altogether that we held with various stakeholder groups. We ran mostly mixed groups, but we did run a specific session with the procurement team, using the workshop time to look at things like the materiality assessment. And as a large acute trust, there weren't really any areas that we would have considered immaterial to the process, but that again would of course vary depending on organisation. We used all this information from the workshops, and I've got another slide with a bit more on what we covered in the workshops, to develop a statement of ambition, basically an interim sustainability plan, which we could use to undertake a full staff consultation exercise. And then whilst that was going on, we continued to refine the full plan, incorporated that feedback that we received to produce the full draft plan. Then we went out to a much smaller process just with key stakeholders there to get their feedback, and then that plan was taken to board by our Chief Operating Officer. So I will say that for us that process did take quite a long time. It was about 6 months from start to finish. It could of course be condensed for smaller organisations, and I think we did have the added complexities of the merger in there, and we were treading very carefully around making sure that we had everybody involved. So yes, it did take 6 months for us, but I'm sure I wouldn't necessarily say it would take 6 months for everybody to do that. I'm not going to cover the drivers in detail because this is of course covered in the guidance document, but what helped us was to categorise those into different groups, as I've shown here on the slide. The local and regional strategies were numerous, and we had to undergo a review of those and decide which one were relevant, and then wherever possible pull out the higher level one. And of course any organisations that are in the process of developing their SDMPs now can include the climate emergency declarations that are being made by NHS organisations, councils and professional bodies to fast track that process of both development and delivery. So I'm sure most of you are familiar with the SDAT, the Sustainable Development Assessment tool, and if you're not already using it, then you can use it to baseline current performance. You can then use the baseline alongside the materiality assessment to select priority objectives for each area of work. I can't remember how many questions are in the SDAT altogether, but I think it's definitely over 250. So of course we wouldn't have included all of those, but we grouped some of those areas together under single objectives, and we haven't covered all of them within this SDMP because that would have made it unachievable with our level of resources. And then once you've carried out the assessment, you can of course use the take the SDAT each year to measure qualitative progress. Can
I just jump in there? Course, we've had a question. I have used the SD8 tool, but not the materiality assessment. How have people found the materiality assessment?
Shall I answer that one? So the materiality assessment, it's not in the SDAT tool, there is in the guidance document that Scott has put on the handouts there, I think. There is information in there about how to carry out the materiality assessment, and I found that quite a straightforward process to just look at each of the areas and what impact and influence we had over each of those areas. So I think if you just have a look at the guidance document. Yeah, we developed this as well, which I know seems like another level, but it actually really helped us. I think as an environmental professional, I was conscious of not just leaping in at the environmental aspects of everything, and I wanted to make sure this was more all-encompassing. So we applied these 4 different lenses of environment, health, future and community, and then we made sure when objective setting under each of the 10 areas of focus that we had objectives that were covering each one of those. I'm not going to go through the objectives today, but our SDMP is publicly available. If you just Google MFT SDMP, you can download a copy and have a look at that. So to get your plan board approved, you will of course need a senior lead. and they will need to be director level or above, I think, to get that to board level approval. I've listed some of the stakeholder groups here that we engage with, but I'm sure this isn't everybody, and it wouldn't necessarily be possible to get representatives from all of these groups for every organisation. But this is being done from my perspective, working in Acute Trust. So I mentioned before about the workshops. So at the workshops, we looked at who all of our stakeholders were and where we were already working with them, what we were already doing. We looked at some case studies, we looked at other organisational strategies, a few within the healthcare sector, but also plenty that weren't, and some from key suppliers to the NHS as well, so that people were able to say what they liked and didn't like about the way that had been presented. And it started to give us some ideas about how we would form ours. So we also considered things like mega trends and how healthcare was changing in the future and how that would impact upon sustainability. So things like ageing population, rising prevalence of chronic diseases, and growth in areas such as artificial intelligence. And that was something that people really responded well to. So data is, of course, absolutely key to this process, and this is made much easier for us working in the healthcare sector because we're already reporting this through ERIC and through the annual sustainability submissions. But what I would say is that even if you're confident about your current data, do review your historical data to ensure it's all accurate, particularly if you've inherited that data from someone else. And then when you're setting your carbon reduction targets, do make sure that you think about both your core carbon emissions over which you've got a greater degree of control, and also those over which you don't have control but you do have varying degrees of influence. And personally, our strategy does cover all aspects of our carbon footprint, but we are focusing on working collaboratively with our regional partners, in particular around some of those things like supply chain emissions, because we think that we'll have more success at that level. And then we also reflected on our plan those external factors over which we don't have control, which would have both positive and negative impact on our carbon footprint. And we wanted to be really transparent here and not be claiming reductions for something that we haven't actually achieved, or carrying the burden of something that we had no control over, such as weather or number of patient contacts. So we'll report on both of those annually as well. So I talked before about the importance of senior level buy-in, and I think if you haven't already got this, then use some of this media attention that we've got at the moment to be able to leverage this. So I pulled out a couple of things from August this year where NHS trusts were appearing in the media for either not having an SDMP or not hitting their carbon reduction targets. So yeah, absolutely use that if you can, because that will get your senior management on board if they're not already. So it'd be helpful if you have your communications team involved in the process, and that will be different degrees at different stages. So during the development stage, they'd be able to advise on corporate branding requirements, and also making sure that your strategy is written in accessible language, bearing in mind this is a publicly facing document. During the launch, I'd advise running an awareness campaign and events where you can actually go and engage staff and ask them about what's important to them and how they can help deliver against it. And during the implementation, you will need to make sure that you're reviewing that plan annually, making sure that it's fully up to date, and maybe producing a standalone report as well as your mandatory submission. So in terms of implementing the SDMP, we keep a live tracker spreadsheet which details all the programmes that we're delivering each year, who is leading on them, what we're delivering, and how they link to each one of our SDMP objectives, because there's a mixture in there. There's things that we would just do, and then there are things that we'll build on each year. So we make sure that we've clearly linked that, and then we give those formal updates to groups throughout the year. So we've got internal quarterly reports that we do, and then we've just developed a dashboard to support that process, and then our annual report is our public facing update against that. I've just pulled out something here from a few bits from our annual report. We followed the lead of a few other trusts in producing our first standalone one this year, off the back of having our new SDMP in place, but also having our content slightly condensed in the main trust annual report. But that's a really good way, I think, of looking back each year. Whether you're producing a 1 year, 3 year or 5 year plan, it is helpful to have that formal report to look back on. So in terms of us being 1 year in then, what's going really well? So I think that our senior management are certainly assured by the fact that we have this robust SDMP in place, and we can be really honest with them about where we're performing and underperforming against that. And there's talk of PAM assessments becoming mandatory now, so we will be able to evidence that. We're using our experience and working with our local integrated care system to help develop their SDMP. It is being used as a live document, not just by us within the sustainability team, but I know that others are regularly referring to it as well, particularly in terms of like the major capital developments that the organisation has committed to, but also within the procurement team as well. And I just think it gives us that structure now, so we know what we're going to do every year. We know that everything we're delivering is contributing to the delivery of this 5-year strategy that we put in place. What do we still need to do? Well, we are currently doing our first annual refresh because our since we put our first strategy out, the Climate Change Act has been changed, and our local authority has changed some of their targets as well. So we're addressing that by being very clear that we're talking about carbon budgets now rather than an annual reduction, and being very clear about what we can and can't achieve within the resources that we've got. So it's less important about the end dates that people are talking about. We haven't yet embedded this into our organisation vision and values. There's some things that we still need to do there, and what I'm really keen to do as well is to make sure that we can attach carbon reduction, if applicable, to each programme that we deliver, so that we know that we can achieve those reductions. So top tips, don't underestimate how long the planning bit will take. There'll be a lot of work that you'll do that won't end up in the final document, but it's absolutely important that you still do this. Use all those examples out there. There's certainly a lot more out there now than there was when from the healthcare sector when we were doing this, so use all of those. Work closely with your local authority if you're not already, and look at their environmental plans. And I think the other thing I was going to say was just don't wait, because there's always going to be a new strategy on the horizon, whether it's something from within the NHS or whether it's something from within your local authority. I would say just go ahead, and you can just address those things in your annual review process. Hopefully you've got some help with writing the SDMP, and if you have, then clearly define and share those responsibilities. Make sure that you've covered all those aspects, not just environmental, make it visually appealing as well. And then keep it live and relevant by having that plan every year that you're referring back to each time, and that you're continuing to engage with your staff and other stakeholders on the agenda. So I think that's it from me. I think we're doing questions at the end.
Yeah, we're going to do some questions at the end, and obviously we have one link coming there. But there's one question I wanted to ask, which was back to your communication slide. I think I'm around about slide 4. Yeah. And this is, well, I don't say it's a controversial question, because we've seen James Dixon at Newcastle, and we've seen recently, I think it was Bristol, and a number of others calling a climate emergency, obviously, which has been in the headlines, and thank you to James and others for leading on that. But would a climate emergency help get buy-in to an SDMP, or do you feel that by calling a climate emergency, it is a risky thing to do because you may not have the resources in place to do anything about it? How would you approach that?
So my take, I think we ourselves did also declare a climate emergency, and it was only about earlier on in November. It wasn't very long ago. And the way I saw it was, it wasn't necessarily about doing something different, but it was about leveraging that agenda. And I know I've seen that staff have responded really, really well to that. I think you've got to be really careful that if you're going to do that, that you've got the backup behind it. And I can see that from what the organisations are doing already. You've got to be prepared that you're going to be putting out those regular messages, regular updates, and what you're doing. It can't just be words, that we're doing that without any action and without naming any names. I've seen some of the local authorities that have done that, not done anything for a period of time, and then there's the pressure there. So to me, it was a way of just fast tracking and also delivering some of the things that we'd already committed to in our SDMP to make it part of the way that the organisation operates.
Okay, yeah, that's fantastic. Well, thank you very much for your time, Claire.
Thank you.
And we're going to now hand over to our next speaker, which is Alexandra Hammond. Alexandra has been at the forefront of SDMPs and supporting guys in St Thomas in the past, and she's going to talk a little bit more about some of the work she's done and some of her perspectives on that. Over to you, Alexandra.
Thanks, Scott. Can I just double check that people can hear me and that the screen is coming up with my presentation? Is it coming up in presentation mode, or is it coming up as a proper?
It's coming up as a proper slideshow. We can see the full thing, yeah.
Okay, great, wonderful. Thanks very much for including me on the webinar. It's great to be here. And yeah, just by way of introduction, my role has been in the NHS for the last 10 years or so, I led the sustainability program at Guy's and St. Thomas's, and created several iterations of strategies and SDMPs at Guy's and St. Thomas's, and have seen a sort of a focus on carbon. In 2010, everything was about carbon, then it was about models of care and health, and then I think we're getting back to being more about carbon, but also understanding that how important it is for it to integrate with the healthcare delivery that we provide and the communities in which we work. So I think we're kind of getting there in terms of the scope. So I'll just tell you a little bit about what we've done. By way of disclaimer, we are ETL is a commercial company, but we're owned by Guy's and St. Thomas's, and all of our profits are reinvested back into the NHS. So we sort of sit at sort of an arm's length from Guy's and St. Thomas's. Sorry, let me just see if I can get my slide presentation to go ahead. So yeah, I'll just talk a little bit about some of the SDMP planning that we've done, some of the work that we've done outside of Guy's and St. Thomas's as well, and then hopefully provide some insights. I mean, Claire provided a lot of interesting information. My goodness, it's a tough act to follow coming after Claire, because she's done such a great job. But I do appreciate that not every NHS trust has the resource that they have in Manchester, which is unfortunate. If only we all did. But there is. I think there's probably, I'll focus on sort of what I think are the kind of fundamentals to an SDMP and things that really should be there and shouldn't take a huge amount of staff resource to establish and maintain. So here we go with what I think falls on sort of the fundamentals of a sustainable development management plan. So we really work with our clients, internal and external, to understand what the vision and the values of the organization is. It's so important that the Sustainable Development Management Plan sits alongside the already established cultural understanding of the organization, and it's got to fit with your trust values. It's got to fit with your trust vision. It's got to be bought into at a corporate level. Otherwise, it will really always be seen as sort of this extra added thing that people have to do on top, and it really isn't that, and it doesn't need to be that. Obviously, understanding progress to date, understanding the baseline and the things that have come before, and setting that out really clearly. Using data, definitely, showing lots of graphs and information, but really, I think quite importantly, also engaging people. We can get very focused on data and reporting, and it's so important, but it shouldn't be at the expense of the way that we communicate and engage the people who work in our hospitals, because frankly, they have so many ideas. They're the powers that can change the way that we do this. So I think 3 sort of fits in also with 1, which is just understanding the drivers for change. And Claire, I think, summed that up really well. Just really, is it cost? Is it reputational? Is it, we're going to solve climate change? I think there's a lot of different things that drive organizations to have a sustainable development management plan, but understanding what, the trust really, what lights the fire of the people in the trust. Obviously, target setting, making sure that there's a clear aim and objective. Net zero by 2050 is obviously this big thing at the moment, but we need to be thinking about what we do now to get us to net zero to 2050. I mean, we run the risk of this being a big target in the future that we pay lip service to, like Claire was saying, with some kind of emergency declarations, but we lose focus on taking action immediately. And I think really what we need to be doing is putting plans in place and having kind of a roadmap to net zero. And maybe it's going to come before 2050 as well. That's, the other thing is there's a lot of people arguing it needs to happen a lot sooner than that. So, what are the things we can be doing, right now, this year, early next year to start to make a difference? Now, in 5, what I've got there is really the main key headlines within the SDAT model that Claire mentioned. So that really helps us structure and drive action within a sustainable development management plan. We also really encourage materiality assessments, and I think we're conscious though that it can seem kind of complex and scary. So the SDAT is comprehensive. It's long and it's a little bit, it's not always relevant. Not all of it is relevant to every organization. And so you really have to do some sifting through it to make it relevant. So what we try to do is take the key things for, understand the organizations that we're working with, understand what's driving them, and then take out the key points that they think that they need to be asking people about. And we try to sort of track it as, we put it in the format of a survey. We don't, don't give people a big heaping list of things and tell them ask them what they think is important. We do it as kind of an online survey and ask people what they, how much they value that thing. So maybe it's, having really clear objectives around sustainable procurement for the supply chain. So we ask people how important they think that is, and we also ask them how easy they think it is to implement in their organization. And this, I think, is a powerful part of that, because what it gives us is a really kind of good start on our action plan. So we can see the things that people think are really important and relatively easy to implement. Those are the things we need to start doing today. And so that's a really useful tool to sort of focus people's minds on what can be done. Governance and responsibilities, obviously leadership, making sure people are owning these documents is so important, and obviously the ongoing monitoring reporting. So I guess I don't want to focus too much on the contents of an SDMP, as I'm sure that these slides will be shared and you can have a look at this in the details. And also there's lots of very, very excellent guidance on the SDU website around developing an SDMP. But I really think it's really fundamentally important for NHS organizations to get some good data. Now, this is so hard sometimes. Usually this year's data or last year's data is pretty good, but going back to what is the NHS baseline of 2007, 2008 is sometimes tricky, and sometimes it's just not there. You look on ERIC and it's just completely looks all wrong. I really encourage organizations that are worried about data to just take the most recent data they can trust and make that their baseline. The NHS baseline is officially 2007, 2008, but go from real data that you can trust and make that your baseline. So we work with organizations that have a 2010, 2011 baseline. Fine. It's not. I think we can get really focused on getting things exactly right, and we just need to baseline this year and move from that if nothing else. It really is important to draw a line in the sand and get going. So this next slide really is just about the engagement side. So I actually have to say I was really inspired by Claire's SDMP and Manchester, because it really is an engaging document, and I think is probably one of the leading documents in the NHS for that. It's written almost like a kind of with almost like a sort of social media piece. It's easily digestible. It's not too texty. It's set out in a format that's easy to reference and skip around to the bits that you want to read. You don't have to read it from top to bottom. And that's so important. So I really think that's great. And also I think having a senior level person introducing the SDMP and stating right on the first page of that document how important it is to them and the organization that this SDMP is there, then that's really great.
Alex, can I just jump in here a second? We've had a question from Chris Carlson, who says, ask if anyone has implemented a sustainable procurement strategy, so more around procurement. Is that something you looked at through the SDMP?
Yeah, definitely. So we actually do that for a number of organizations that we work with. It's often one of the outputs of the action plans. It's one of the first things that we do, because it's relatively straightforward to implement as a policy. Obviously, making sure that it's followed is more complex, but these are the emissions that we have influence over but not control over, and so having a sustainable procurement policy is really important. I think I did notice that Stephanie Gibney's on the line from NHS Property. NHS supply chain. And I have to say, you know, using the established routes of procurement within the NHS, there's a lot of leadership and a lot of action being taken already within, you know, the big areas of supply to the health sector. And a lot of it is understanding what's already happening, because sometimes we can assume the worst and actually really good things are already happening, but giving them support and pushing, you know, from the trust point of view, saying, actually, this really matters to us. And it gives people within organizations that have a big, you do a lot of purchasing on behalf of the NHS to actually make those, you know, push the supply chain even harder.
Brilliant. Thanks for that question. I'll leave you to rest.
No problem.
Yes.
Okay, thanks. So, I mean, these are things I think that you know, we should all be taking heed of. But you know, celebrating success, you know, even if it's just you know, putting a case study of a you know, a clinician who did something, you know, different, who decided to create a little green team within their department and you know, has saved £2,000. You know, that makes it real. I mean, it's not going to change the world, right? But it matters to that person that they get that credit, but also it shows that, you know, it's doable across the whole organization. And these small bits of action really do, you know, make a big difference. So, you know, really celebrating success that you've had, you entering people in the organization for awards for stuff that they've done. You know, the NHS Sustainability Day Awards are a great example of that. Like Guys and St Thomas's, we had a radiographer who was, you know, had some really good ideas and put them into action off his own back. He was really excited about it, and he won a Sustainability Day Award for that, and he was so proud of it. And every time I see him on site, he's, you know, he talks about it genuinely, and he's one of the loveliest people I know. But anyway, so, you know, really focus on the human side of this. I think is really important. And I think, you know, we have to be really conscious that these documents sometimes can be seen as tick box exercises. So it's so important to just to find ways of making sustainability kind of feel like it's just the normal thing to do. You know, that it's not something you do on Friday when you've you know, done rest of your jobs for the week. It's something that you just do as a course of action every single day. And it's something we should be proud of and we should all be taking responsibility for. So really integrating that into the SDMP and the messaging around it is so important. Sorry, just going to the next one. So just some case studies, and I'm not going to dwell on these. These are just some work that we've done within ETL for NHS organizations. Guys and St Thomas's, I did this when I was working for the trust itself, and you know, I think what we found there was really being able to bring it back to the patient and how it affects, you know, the people that we were delivering services for is really important, but also bringing it back to what makes staff happy. You know, I mean, focusing on the fact that we're really focused on making sure they've got good quality, safe cycle parking and active travel facilities. So if they want to make that change in their life or you know, travel actively to site, they've got a really good option to do that. So not just focusing on carbon and the environment, but also focusing on, you know, just people's day-to-day health and well-being. We're also doing a SDMP for Kettering General Hospital. And these are just some examples of the way that we try to communicate some of the work that's being done, rather than just put it into sort of a word format. We try to you know, bring it out. But you'll see here, you know, we're talking here about reduction in superstranded patients, for example. So those are people, you know, that's bed blocking in another term. And, you know, there's a lot of people that wouldn't see that as having anything to do with sustainability, but actually it really does, because that, you know, when we are providing care that is unnecessary, we are gumming up the works and really preventing our services from doing what they need to do. And so, you know, I think bringing it back to the clinical and health perspective is so important. We're also working with the Royal Marsden, and this is just some examples of some graphs that we use. You know, I think it's important to make sure that we're really bringing out what is happening visually, and also, you know, the materiality assessment. We're currently doing that with the senior team at the Marsden, and it's really interesting for them when they get the feedback to say, you know, this is what you said, and they kind of go, really? That's what we, you know, because of course they all do this on their own, and they're from their own computers. And then they realize actually that other people think the same thing as they do, and actually that they really need to be focusing on taking action. This is just another example of an SDMP we did for a large mental health trust based in Durham in the Northeast. And it's for them, travel is a huge impact because they have so many sites spread over a huge geographical space. So SDMPs can be a real gateway to also developing a sustainable travel plan, and I think this is really important. We're seeing more opportunities in the travel and logistics area to really affect sustainability, and I think we should aim to not just have an SDMP, but also have sustainable travel plans for every NHS trust, because they really do set a framework for impacting carbon emissions and health. So just to wrapping up. There's lots of things that we can be doing to keep going in continual improvement. We really emphasize the importance of a communications plan. So not just putting a document into the board and then having it board approved and having it sort of sit there, but having a plan for that document to be communicated out, and also updated, campaigns that are engaging. Doing a whole behavioral change program can seem really daunting, and it can seem really expensive, and you imagine it needs tons of resource, and it doesn't actually need tons of resource. What it needs is energy on a regular basis, not tons of it, but it needs to be updated and kept fresh, and also people want some feedback from the things that they've done, and it's actually a manageable thing to do if you've got a plan around it. I think also really important, I mentioned this earlier, but having sustainability really be embedded into the culture of the organization is so important. So, not just doing an SDMP to be able to tick it on ERIC, but have an SDMP so it is a living and real document for the organization. I'm happy to take any questions.
Thank you, Alexandra. That's absolutely brilliant. We have had a question come in, but I'm going to save it till the end of Adam's presentation, because I think it relates to a bit of training, and it will be to the whole panel, but I just want to hold on for that one because I think it's worth hearing from Adam's presentation before we come to that. What I wanted to do, just for everybody, we've just got a bit of a poll that we wanted to do, a bit of snap poll really, to see how many of you dialing in today have an SDMP. So I'm just going to launch that now, and you'll have the option to click that. If you just take a look at that and make yourself click how many of you have one, how many you don't. I'll leave that open for a few seconds before we introduce Adam, and it gives you a chance to complete that. And what I will do is I will close that poll in a few moments. As I said, well, I've got a couple of questions after Adam's presentation. Adam's going to come on and speak about some of the work they've already done in Leeds, but also some of the support they're giving across the NHS. So I'm going to close that poll now, and I will share the results of that after this presentation from Adam. So over to you, Adam.
Great, thank you for the introduction, Scott. My name is Adam Newman. I'm a consultant with WRM Sustainability, who are a specialist consultancy who deliver all types of sustainable strategy and other work to do with sustainability, with a particular focus on the NHS. I've been on secondment as the in-house sustainability manager at Leeds Teaching Hospitals over the past 18 months. And today I'm going to sort of run through what Leeds have been doing, and then also what WRM Sustainability have been doing to assist with sustainability strategies with Leeds and within the NHS. I know Alexandra mentioned at the start of her presentation that she had a very tough act to follow after Claire's excellent presentation. It looks like I have two very tough acts to follow after two excellent presentations. So hopefully I can give us the hat trick of good presentations and finish off today with a really good update on SDMPs. I wasn't going to say this, but having listened to the other two presentations, I want to echo everything that Claire and Alexandra have said. I agree pretty much with everything that they said. I think some of the points that were alluded to in both presentations are absolutely valid. And some of the themes I'm going to talk about in my presentation should pick up on those as well. So presentation outline, what is an SDMP? I'm probably going to gloss over that because I think everyone really has, from their last two presentations and obviously from the work that you guys all have been doing, a good grasp on what a sustainable development management plan is. So I'm really going to move into talking about how Leeds' sustainability was prior to the SDMP, our position now, and then talk a little bit about how we developed our SDMP and why you should develop your SDMP. So this is the slide I'm going to gloss over. I do just want to talk about this this Venn diagram on the right side of the screen briefly. We're not environmentalists. We're not Extinction Rebellion. We're not proposing to disconnect all the gas boilers. We're not proposing to cut off our grid connection and go completely green and go solar panel only and wind farm only. We're sustainability advocates, all of us. We're sustainable managers. We're sustainable consultants. And in order to deliver a sustainable health and care system, you need to consider all three pillars of sustainability: environmental, social, and economic. The best worked example I can give for how we can impact this as a national health and care service is through air pollution. So the hospitals and the trusts' activities are creating air pollution through emission of particulate matter, NOxes, sulfur dioxides, etc. And that negative impact on the environment is creating a social issue. And that social issue is the increased incident and exacerbation of respiratory and cardiovascular illness. And that social issue of increased illnesses is leading to an economic problem. Those people who become ill, who have their illnesses exacerbated, miss work, they miss pay from their work. And also they become patients in our hospitals, which creates an economic push and an economic strain on the hospitals because they have to treat those patients. So we can see that if we address the environmental impact of air pollution, we become cleaner, we become more efficient, we reduce the amount of pollutants that we put into the air, we reduce the amount of people whom we're causing respiratory and cardiovascular illnesses, which reduces the number of patients who come through our doors, which reduces our activities, which means that we can reduce our air pollution further. So this is a really good example of where that sustainable health and care system can be delivered through consideration of all these three facets of sustainability, which is through the heart of all the sustainability strategy that Leeds do and that WRM Sustainability consider. So moving swiftly on, where was Leeds prior to our SDMP? And the key point I want to pick up here really, and it's something that Claire touched on, is that we had a lack of senior level buy-in. We didn't have a really high level advocate within the organisation backing the sustainability agenda, lending their credence and putting their weight behind what we're trying to achieve. Now that I've been working as the in-house sustainability manager at Leeds for the past year, 18 months, having somebody, a band nine, a director, somebody really senior who can knock on doors and help you get into the offices you need to in order to have the conversations that you need to have in order to instigate and change the culture and change the activities of your trust is absolutely invaluable. And having an SDMP that clearly sets out your objectives and targets, that really organises and provides a single strategic approach to sustainability at your organisation is absolutely invaluable, because as we all know, everybody within the NHS is time poor. There's drivers left and right and different regulations and different targets that everyone has to meet. And as you go higher and higher and up the organisation, they've got more and more plates spinning. So having one central document, one SDMP that clearly sets out your strategy and your agenda that they can easily refer to and say, we are held against this document, we're held against the targets in it, and we throw our weight behind it, makes it easier and more achievable and more practical to implement the sustainability change within your organisation. So we're now in a position where we have genuine senior level buy-in. I've presented at our team brief with our CEO, Julian Hartley at Leeds, who is an advocate of sustainability personally and now is throwing his weight behind sustainability at the trust. Through our SDMP, we've developed something called the SSMG, another bit of a mouthful there, Strategic Sustainability Management Group. which is chaired by our board level director of estates and facilities. And we've split our sustainability activities into 6 different work streams, from energy and utilities to transport to building the new hospital, which Leeds is building, and a few other areas, all of which are headed by a Band 8 or Band 9 level senior manager within the trust who's responsible and accountable for that particular work stream. So we really do have senior level buy-in to the sustainability agenda at Leeds, which again is just invaluable for getting into the rooms that you need to be in, having the conversations that you need to have, and having people backing your goals, your targets, and your strategy. And one of the things that we're pushing for at Leeds at the moment as well is an ISO 14001 environmental management system. For those of you who are unfamiliar with what an ISO 14001 is, that is a process by which you get certified by an external third party to an internationally recognized standard for environmental management. And the environmental management system is an annual cycle of continuous improvement that commits you to achieving environmental objectives, improving your environmental performance, and also improving your compliance with pertinent environmental legislation and regulation. So we're working towards that, hoping to go through the certification process just before the end of the financial year, sort of March, April time. We're underway, obviously, with sustainability interventions in a broad scope of areas across the trust, trying to tackle our scope 1, 2, and 3 emissions. And not just carbon reduction, but awareness, social value, all the things that we can do in terms of sustainability. That's what we're looking at, and we're underway. And by 2025, we estimate that we will be achieving at least a 16,000 ton reduction in our annual CO2 emissions, and also saving in between £2 to £2.5 million a year. Just to put that into some context, Leeds is a rather large NHS trust, not quite as large as Manchester. I did see Claire's numbers, and we're just underneath that. We're about 1.8 million patients a year, whereas I think Claire was saying that Manchester's just over 2 million. But we've got 2,500 beds, we've got 5 major sites, and around about 18,000 staff. So we're a significant organisation within the NHS. So a little bit now about how we developed our SDMP. So the SDMP was developed in collaboration between the in-house sustainability team at Leeds and with WM Sustainability. And these are some extracts from the SDMP document. This is the front cover of the glossy magazine, and a little bit about the contents of the document here. This is a slide I want to just dwell on a little bit, and this shows the structured approach that we take towards formatting and formulating and developing SDMPs. So it begins with a review of national regulation, national drivers, legislation, guidance, best practice. So Leeds is, just as an example, Leeds' SDMP was written back in 2015, 2016. The main driver then was the Climate Change Act 2008, and at the time that committed the country to an 80% reduction on emission levels by 2050. Theresa May's last act as Prime Minister back in the summer was to update that Climate Change Act to carbon net zero by 2050. So Leeds' SDMP is now out of date because the driver has changed. So one thing that we focus on and make sure we're the most up-to-date as possible is to ensure that we always keep our ear to the ground when it comes to changes in drivers, and that we need to update the SDMP as and when those drivers change and are altered. We also like to review organisational performance. So I'm just going to drop out of this presentation briefly. How we do that is by producing a carbon baseline, and our carbon baselines consider, for Leeds it was a mixture of scope 1, scope 2 and scope 3 emissions. And this includes, I'm not going to dwell into too much detail because it's too much to go through now, but you can see the level of detail that we try to get on electricity figures, gas figures, water, fleet, waste, and all those sorts of things in order to provide the most accurate and usable data in order to assess your performance as a trust in terms of efficiency, in terms of carbon baselines and the like. Bear with me whilst I just go back into the presentation. Once we've done that, so once we've looked at the national and sector guidance and drivers, and we've calculated your carbon baseline and we set ourselves some targets, we then go into an extensive phase of colleague engagement, stakeholder engagement. So this is really important. I mean, we worked with a lot of organisations within the NHS and outside of the NHS on all sorts of sustainability strategies and plans. So we have a long list of actions where we know if you do X, Y, and Z, that will have a positive impact on the environment, it will reduce your carbon emissions. But when we come into a new organisation, when we came into Leeds, we arranged interviews with a whole host of different people, key members of the staff across different organisations to understand what had already been done, understand what had been successful, what hadn't been successful, and to find the gap between what's been implemented and what could be implemented, and where suggested activities that we may have wouldn't necessarily mesh or fit with the current situation within the trust. Finding out what's already been done is very important as well. A lot of the time, we find that organisations have already conducted a lot of sustainability activity without realising that it's sustainability. They've done so through cost-saving measures, they've done so for a variety of reasons, but they've not considered the sustainable benefit that those actions have taken. So we like to have that sort of stakeholder engagement in order to extract that information and to say we're not starting from a standstill. There's already been a whole load of good work going on, and we can build on that. And I think that's a really useful exercise. Once we've done that, we then get into the analysis and data assimilation, which is to produce targets, objectives, practicable, realistic objectives that can help the trust and the CCG or whatever NHS organisation it is to meet the aims it sets itself. We then go through the process of preparing a strategy document and getting that board level sign off, which really is the first step to getting that senior level buy-in that we're all after. So this is just a summary of Leeds' baseline position. So this is 2013-14, and just under 100,000 tonnes of CO2 equivalent emissions per annum was our baseline. And this is really useful in that data assimilation and analysis step. So we've done the baseline, we've calculated and measured what we think our impact is. And now through this analysis, we can see that the key areas are electricity, gas, and commuting. So when I go out and I speak to my colleagues throughout the trust to talk about sustainability, that conversation inevitably, and I'm sure this is the experience that Claire and Alexandria have had as well, comes back to waste, and obviously some of the attendees looking in, it always comes back to waste. Everybody wants to talk about that because of Blue Planet 2 and David Attenborough, and that's fantastic because it shows that there's an appetite there amongst our colleagues to address sustainability. But it's peanuts in terms of carbon emissions when we really look at it. So this appropriate data analysis allows us to focus our activities on the areas that are going to have the really, really big impact. Anesthetic gases is a big one. It's a really easy win. Again, I'm just going to bob out now. And Scott, I'm going to be nominating our anaesthetic team for an award at the Sustainability Day campaign. You can see here, combined CO2 emissions. These are the most recent figures we've got. Anesthetic gases peaking at 560 tonnes in October in 2013. Last month, they've got it down to 170. Really, really good example of behaviour change campaign, clinicians taking the initiative, showing that there are people outside of the states and facilities, outside of the sustainability team, who've got a real drive and a real motivation to impact sustainability within the trust. Finding this through colleague engagement, reporting it and capturing it all within your sustainability plan, absolutely vital. And a really good case study there. happy to share information on that with anyone who's interested. Here are the targets we set ourselves. So these are aligned to the SDU reduction targets, and these were aligned to what was then the up-to-date 2008 Climate Change Act. Having really set objectives and targets is key for getting senior level buy-in. We report to the board quarterly through F&P, Finance and Performance. I'm sure you probably have something similar within your own trust. And as I said earlier, we get scrutinised now by exec directors, non-exec directors, the CEO, the chairwoman of the trust, and they hold us to account on these targets. And the fact that they scrutinise and hold us to account on these targets means that the seniors within our trust who are accountable and responsible for the sustainability strategy have to throw their weight behind us, because they're getting pressure from the top. Why aren't we hitting this target? Or if we are hitting this target, great, how do we move on? How do we get to the next target? Having this all aligned within your calculated baseline, your clear objectives, your central sustainability strategy is absolutely key for securing that senior level buy-in. This is an excerpt from the action plan section of our document. So within Leeds' SDMP, there are 83 different specific actions, all of which are designed to improve sustainability of the trust. And as I've been sustainability manager at Leeds for the last year, this section of the document has been invaluable to me, because instead of just having detail about the actions and interventions, we spent a lot of time at the planning stage aligning all of these actions with the most appropriate person, the most relevant person within the trust who we can work with to actually implement and action that change. So this action plan, it took absolutely ages to develop. I'm not going to lie, it was a bit of a painstaking task at the time. But now that I'm on the other side of the fence, working for the trust to implement it, this action plan has been so useful, because it allows me just to go through, tick them off as soon as I complete them, find out who it is that I need to be speaking to, find out when it is that I need to be monitoring it, and use this to report back to the board, back to the senior levels who are bought into this agenda, and show them how we're progressing.
Love this. That's a really good idea, Adam. Fantastic. That. It's a really good pump. That. Yeah, brilliant.
Good. And like I say, just one excerpt. Like I said, it takes up the majority of the document, that action plan, but it's definitely worthwhile. So, finally, why should you develop an SDMP? It's part of the service contract, as I'm sure probably everyone's aware. I mean, Scott spoke about this at the start, and he's done his survey about who has one and how many SDMPs there are up and down the country. I know for a fact, I won't name names, but I've developed SDMPs, and WRM Sustainability have developed SDMPs for other NHS organisations, and that's a document that's sat on the shelf and collected dust and hasn't been taken off the shelf and opened since it was delivered to them. So you shouldn't just have an SDMP, you should also be implementing that SDMP and working towards delivering that SDMP. Aside from that, I mean, there's loads of external pressure now, loads of stakeholders outside the NHS who are all declaring climate emergencies. The general election, climate change is one of the key topics. Last time it got 5 minutes at the end of a debate. Now it's one of the key areas. More and more people are waking up to the requirement to become more sustainable, more green, more environmentally friendly, and asking questions of the NHS. What are you doing? What are we doing? And the way that we can answer that, the way that you can have a really strong, robust response to people who question what it is that your trust or your CCG is doing, is to say, we've got a really well-defined, really well-considered, well-thought-out, reasonable, actionable SDMP, which centralises our agenda and allows our seniors to get behind it, back us, and help us to green the NHS in order to deliver a more sustainable NHS and a more sustainable UK. That's the end of my presentation. I think I just went over the 15-minute allocation, so I do apologise for that, Scott. I know you like to keep some time.
It's absolutely fine. It's absolutely fine. Can I get all three speakers just to unmute so they can just answer a couple of questions we've got? The first one we've got, I'm going to just show my screen now, just so we've got that there, and we can move over to questions. However, I'm just going to ask one of the questions we've had in, which is, is there a training package or educational support for senior level management on sustainable development to support with decision making. That's why I wanted to hold on to Adam's presentation, because he touched on senior level buy-in with the infographic put together, and painstakingly it took a lot of time to do. But is there any training that can be delivered for those? Because the sustainable managers that are probably on today's webinar, and yourself, Alex and Claire, buy into this, have got this, but the biggest task is obviously getting senior people to buy into that. Is there any training and support that can be given to them?
So there is the carbon literacy. Carbon literacy is one that you hear quite a lot, and that is it's both a company who sell sort of a carbon literacy training package and also just a general term, and you can formulate your own carbon literacy as the in-house sustainability manager about the things that you need to communicate to the senior managers and to the top level of the organization, to give them an understanding of the key issues, so that when they get questioned by people within the organization, people outside of the organization, they know what it is that they're talking about. They know the key points. They know the broad brushstrokes about climate change and sustainability, but also they know what it is that you're doing as a sustainability manager, so that they can always tie the external drivers back to what the trust is doing. Because obviously the senior level guys and both ladies and gentlemen at the senior level are sort of aware of the political pressures that are going on. So allowing it to be tied back to what your organisation is doing is really useful as well.
Claire, Alex, anything to add on that?
I was just going to mention the same as what was what just said, really. In Greater Manchester, we have been trialling a healthcare specific version of carbon literacy, and I sat in on one about a month ago that they were delivering to population health and wellbeing team at the partnership, and it was an excellent training course. It is quite a commitment in terms of time. There's preparation, and then the course was condensed down into, I think it was about 4 to 5 hours. If you can get support to do that within your organisation, then I definitely recommend that, but that won't be possible for everybody due to the time commitment.
Alex, anything to add on that?
I mean, not exactly, but I do think that I'm just looking on my screen to see if I can find it, but I do recall the SDU is going to put out some training around sort of senior conversations around sustainability, sort of give some guidance around it. I'm not sure if that ever happened, but it's certainly something that can be a bit daunting, and is worth getting getting sorted. So yeah, I would say that the other thing I would say is that speak to each other and let people collaborate. If there's people have concerns or want to share experiences around having those senior level conversations and engaging with senior people effectively. Certainly, it's about sharing experiences and saying what went well and what perhaps didn't go so well.
Okay, we've got another question here quickly. How are you implementing the SDMP requirements on your supply chain, extensions or expansion of existing infrastructure? And that's from Nidhi Baiswar. Anyone want to do that on the supply chain? It is a common thing that I've been discussing with leadership boards for a number of months. How do we get the supply chain involved? Is there anyone who wants to come in on that question?
I'll start with it. I can't fully answer the question, but we had a student in on a paid internship over the summer, and this was almost the exact project that we gave to her to look at. She was with us for about 10 weeks. We'd set it in our SDMP as one of our objectives. We've been working closely with our local procurement team and with the regional procurement team, but I wouldn't say we have a fully established approach yet to do that. But we had the student looking at different ways in which we could engage with our suppliers, what was already out there, and that's something I think will be on my work plan for the next financial year, because I haven't got capacity to finish that piece this financial year. But I'm happy to share that when we're a bit further along with it.
Yeah, I was just going to add to that as well. NHS supply chain which for Leeds, I know about 80% of everything that Leeds procures comes through NHS supply chain. I'm sure it's probably similar for figures for the other organisations as well. NHS supply chain is accredited to ISO 14001, which is what I spoke about, something that Lisa's, one of our ambitions is to become accredited to ISO 14001, which means that the supply chain itself is actively managing its environmental impacts and its contribution to climate change through its accredited EMS. So the supply chain itself is already working towards that. One of the things that we're doing away from NHS supply chain is engaging with the directors of procurement at the Trust to try to, when the next set of tenders and next set of tender evaluation comes out, incorporating sustainability as a weighting for decision making. So currently it's predominantly done on quality and price. The conversations we're having currently, and they're going well, is to have a 5% weighting or a 10% weighting for sustainability on frameworks, as and where those frameworks are flexible, because some of them are already set. But where there's capacity to set our own evaluation criteria, we're trying to get sustainability factored into those tenders.
Do you think 10% is high enough? Because some people call it to be a lot higher than 10% on some of the areas.
It's a start. It's a start, Scott. Frankly, as an out-and-out sustainability advocate, no, I'd have like 60%. But as a realistic way to go from it being an afterthought that's not even considered in most frameworks to having it on there as a decision-making criteria, I think 10% is a step in the right direction.
Yeah, definitely. Alex, you got anything to add to that?
Just a really quick thing on it. I think one of the things that's hardest about supply chain is understanding procurement and specifications and how they work and what goes into them and how you actually embed sustainability into it. It's not generally the skill set, the core skill set of a sustainability manager to be a procurement professional. So, and nor necessarily should it be. So I think one of the things that we've been doing at ETL is working with on certain things like waste tenders or patient transport tenders, the big ones, where we've been looking at what kind of wording and specification, wording needs to go into the specification for it to be then really have that impact on sustainability. So, so often when it comes to those big contracts, people look at how they tendered 10 years ago or 5 years ago or something, and they just take that specification and roll it out again because they just don't know how to improve it. They don't know how they might have the resource, and perhaps they're just not paying that much attention. So I think it's really important that those specifications get written well and lean on people who understand procurement, and sustainability, not just us. There are others out there, because it's really an effective way of getting sustainability embedded.
Fantastic. Well, I'm going to bring this to a close now because we're slightly overrun, but I think it's been very engaging. And I just want to share a couple of things. These are the results of the poll we did, which was 70% of people in here clicked to vote. And this was the result for how many of you. It's not showing it, I don't think.
Yeah,
anyway.
it's showing.
Oh, is it showing? Okay, so
Yeah.
71% said yes, 29% said no, which is very similar to what we had with the poll. It's always been the 70-30 split. Hopefully we can get to the point where we see that improving as we go forward. I've got one more, and this is something actually that me and Fiona was speaking about on LinkedIn the other night, which was our kind of updated progress report on the NHS England, NHS Improvement and how they're doing. Fiona's very conscious, as is Sonia, about some of the work that has come out and some of the initiatives they're doing. PERDA's played a big part in a lot of things not happening over the last few weeks. I'm sure there's a lot coming out in January, but we wanted to just do a quick snapshot of the remaining attendees to just ask this question. Can you see that?
Yes, we can.
So how many of you think NHS England Improvement are doing enough on sustainability? Yes or no? And I'll wait till we've got enough people who voted and then I will close it. It's a great tool. I love playing around with this. It's like a kid in a toy shop with this. Right, I'm going to close that now. And that's there. 89% not enough, 11% enough. So Right. Okay. Well, I think that's the general consensus we've had as well. I do think there's a lot to be done, but I also think that through this campaign, through individuals such as our panel today and others, we can help support that. It is a collaboration. It is not about a blame culture, and that's certainly not what we're doing from a campaign, but we want to make sure we can start improving on them percentages to support NHS improvement in England, because it is a difficult subject matter to do. As you just touched on there about procurement, and there's no silver bullet to any of this, and it's all about small baby steps and supporting each other from peer to peer. I want to just say thank you to the panel today, to Alex, to Claire, and to Adam. Thank you to WRM for sponsoring this webinar and being a member of the campaign. Going forward, our resources, I'll be sharing some pictures of our latest resources. We've had 45 trusts order the resources already. They'll be distributed in January, and you'll be getting them and can order them up to the 16th of March. The theme for next year's Sustainability Day I've put out recently is going to be failure. And that is going to be, we want to hear from people who failed in maybe implementing a sustainable project along the way and what they learned from that, so we can all share ways of learning going forward. We shouldn't be seeing failure as a negative thing. We should be seeing it as a way of improving and sharing best practice. So I hope you will get involved with Sustainability Day, order the resources. And our next roadshow will be up in Manchester, where we will have Martin Toomey, who is Head of Sustainability for NHS Supply Chain, talking about what they're going to do. And that's on the 6th of February at the University of Manchester Innovation Centre. We'll also have one of Andy Burnham's team talking about embedding sustainability in health and social care contracts within Manchester. And we will also have a number of other speakers talking about procurement and sustainability as an overarching theme. So once again, thank you very much for all coming today and listening to the webinar. A recording will be available from Tuesday for people who are looking to do that. So thanks for listening, and thanks again for your time, and I'm sure I'll see you all in the future. Thank you very much.
Thanks, Scott.
Bye.
Thanks, Scott.
Bye.
Cheers, guys.
Thanks. Bye.